A very good morning to all of you. So continue our series of must read topics before your university exam for MD exam. So paper 1 already we have covered. Okay, if you don't watch that video, so you must watch that. What important things you must read in paper 1. Today we will cover the paper 2. Okay, so what are the important things that you must read before your university exam in paper 2? So first comes on the enzymes. In enzymes, the important thing is that what is the definition of enzyme and classification of enzyme. Although it's asked very rarely, but still you have to prepare the classification of enzyme, and it is also important for your Viva also. Okay, all right. Second question is that of factor affecting the rate of enzyme catalyzed reaction. Okay, important question. What are the factors that affect the enzyme catalyzed reaction? Next is that of isoenzyme. Isoenzyme is very important topic. Isoenzyme and what is difference between isoenzyme and your isoforms. Okay, so isoenzyme and isoforms and role in metabolic regulation. That is, question can be asked, what are isoenzyme and what is difference between isoenzyme and isoforms? You know the difference between isoenzyme and isoform and what is the clinical significance of these isoenzymes. Okay. Next is that of enzyme inhibition. You should know every kind of enzyme inhibition, reversible, irreversible, that is competitive, non-competitive, uncompetitive, feedback inhibition, allosteric regulation, how is there, suicidal inhibition. So each and every inhibition you have to read. Okay. Next is that of application of enzyme. It's very important topic, application of enzyme. What is the diagnostic, therapeutic and commercial use of enzyme? Asked as a LAQ or in 10 marks answer question, it can be asked. Okay. Next comes on the bioenergetics. Bioenergetics, important thing is that of you should know the thermodynamic law. What are the different thermodynamic law as a short note? And what is difference between exergonic and undergonic reaction? Okay. And next short note is high energy compounds. High energy compounds asked as a short note in various previous examinations. So high energy compounds is important topic for your short note. And important thing is they are for cytochrome. Short note asked as a cytochrome, or a question can be asked as a note, write a note on your cytochromes. Okay. Now biological oxidation. Biological oxidation is one of the important and must read topic in your exam. Okay. So in biological oxidation, important thing is what is electron transport chain, what is chemiosmotic theory, and what are the inhibitors and uncouplers of ETC. Okay. Beside that, you must also know what is the Oxford disease. OXPHOS. Okay, what are the Oxford diseases? Oxford diseases are that disorders which are related to your oxidative phosphorylation. Okay, Oxford disease. All right. So these are the must read in your biological oxidation. Now comes on the metabolism. Carbohydrate metabolism. In carbohydrate, although it's each and everything is important, but must read is that of Rappaport-Levering cycle. That is, what is Rappaport-Levering cycle? What is the significance of this Rappaport-Levering cycle? Second, in TCA cycle, you must read, that is, what is the anaplerotic and amphibolic role of TCA. Okay, TCA cycle never ever asks as such in MD. Okay, and in TCA cycle, you should know the basic idea what is the amphibolic role and what is the anaplerotic role of TCA cycle. Alright. And next short note is that of PDH complex. Pyruvate dehydrogenase complex is asked as a short note. Then important glycogen metabolism. Everything is important. Glycogenesis as well as glycogenolysis and your glycogen storage disorder. Must read topics. Next is that of gluconeogenesis. What is gluconeogenesis? How the glucose is synthesized from pyruvate is sometimes asked, from alanine, how it is synthesized, from propionyl CoA, how it is synthesized. So you should know each and everything for how these from these pyruvate, propionyl CoA and alanine, how the glucose will synthesize in gluconeogenesis, and how how glycogenesis, glycogenolysis and gluconeogenesis are regulated. Regulation of all these cycles is an important. Okay. Now comes on the galactose metabolism. Galactose metabolism you must read before your exam is that of classical galactosemia. Short note asked as a what is classical galactosemia. Okay, that you have to know. And in fructose metabolism, essential fructosuria asked as a short. And these galactose and fructose metabolism are important for your case-based study. Case-based question is asked in some universities. For that galactose and fructose metabolism is important, and for theory purpose, at least classical galactosemia and essential fructosuria you have to read. Okay. Next comes on the HMP shunt. Very, very important topic. What is HMP shunt? What is the significance of HMP shunt? And what is G6PD deficiency? Okay. And what are the various risk factors of your G6PD? Okay. With these three things you must read in HMP shunt. Next important is uronic acid pathway. What is uronic acid pathway and what is the clinical significance of uronic acid pathway? You must read. Alright. Next is that of polyol or sorbitol pathway. Okay. Polyol and sorbitol pathway is also asked in few university exam before. Okay. Next important LAQ is that of regulation of blood glucose. How blood glucose is regulated in your body and what is hyperglycemia, hypoglycemia and their clinical significance. LAQ. Okay. Next short note is that of glucose tolerance test and its interpretation. Glucose tolerance and interpretation asked as a short note. Now diabetes mellitus, each and everything you must read in diabetes mellitus because asked as a short note in split question or asked as a LAQ. So in diabetes mellitus, you should know the classification, pathogenesis, metabolic rearrangement, complication, what is the diagnostic criteria, what is ADA criteria, what is WHO criteria, both ADA criteria, WHO criteria, both you have to know, and what are the different laboratory investigation you will perform in diabetes mellitus, and what is the principle of treatment, that is including dietary and lifestyle modification. And on HbA1c, you should prepare as a short note. On HbA1c, ask as a individually as a short note. Okay. Alright. So this is all about your carbohydrate metabolism. Now comes on the lipid metabolism. Lipid metabolism important is that of eicosanoids. That is how the prostaglandins are synthesized and what is their clinical significance. You must read this topic. Okay, next is that of beta oxidation of fatty acid. Very important. What is the beta oxidation of fatty acid? How it is regulated? What is the energetics of beta oxidation? And what are the different disorders which are associated with the beta oxidation of fatty acid? Alright. Next important question is the metabolism of adipose tissue and its regulation. Important. Okay. Next is that of comes on the cholesterol. Okay. So how the metabolism of cholesterol occur and how its transport and what hypercholesterolemia. That is Friderichsen classification you have to know. Type 1, 2, 3, 4, 5, 6. Okay. And then lipoprotein metabolism. In lipoprotein metabolism, important is that of chylomicrons and HDL. Although chylomicrons, VLDL and HDL, all three are important, but frequently is that of metabolism of chylomicrons and your metabolism of HDL. In HDL, the question is asked, define the metabolism of HDL, why HDL is known as good cholesterol, and what is reverse transport of cholesterol in HDL metabolism. So these must read topics in your lipoprotein metabolism. Alright. An important short note in lipid metabolism is that of fatty liver, asked as a short note. Metabolic syndrome asked as a short note, and your lipid profile also asked as a short note. Okay, and is that of your alcohol metabolism. Alright, so alcohol metabolism is also asked as a short note. Alright, and then cholesterol metabolism, very important. So important topic is that of cholesterol, how cholesterol is synthesized in the body, that is cholesterol synthesis, and what are the different degradation products of your cholesterol. Yeah, cholesterol degradation. So both cholesterol synthesis as well as cholesterol degradation must read. Next important is your ketone body synthesis. Very, very important topic. Okay. Alright. So ketogenesis. Okay. How ketone bodies are synthesized. And important question in additional added in that is that of how ketone bodies are synthesized and why liver cannot utilize itself the ketone bodies. So you should know the reason and you should explain why liver itself cannot use ketone bodies. Okay, because enzyme thiopherase is absent in liver. Okay, you will need that. Okay, and what is ketonemia? Okay, ketonemia. So ketone bodies is everything is important. Synthesis, lysis, and why liver cannot utilize itself the ketone bodies. Okay, and what is diabetic ketoacidosis? DKE, that is diabetic ketoacidosis. Answer is a short note. So this thing you must know in ketone bodies. Now comes on the amino acid and protein metabolism. Important is what is deamination, what is transamination, urea cycle. Very important. What is urea cycle? What are the different disorders related with the urea cycle? And why ammonia is toxic in nature. Okay, why ammonia toxicity is there, or question can be asked why ammonia causes hepatoencephalopathy. I already shared my video on that. You can watch that. Okay. Now in individual amino acid, important is that of glycine. Glycine is asked individually as important, and beside that glycine, phenylalanine, tyrosine, tryptophan. Okay, glycine, phenylalanine, tyrosine, tryptophan, and your sulfur-containing methionine and homocysteine. Okay, so these individual amino acid you must read. And important short note is that of homocysteinemia. Short note, homocysteinemia as your short note. Another short note is that of inborn error of protein metabolism, that is of your phenylketonuria, alkaptonuria, maple syrup urine disease. Okay, okay, all right. And these are the must read topics in your this thing, protein metabolism, and your 1 carbon metabolism also. In 1 carbon metabolism, you will also cover in your vitamins also. So 1 carbon metabolism is important for your MD exam. And another short note is that of biogenic amines. What are biogenic amines? It's important for your short note. Okay. Now comes on the metabolism of your nucleotides. Nucleotide metabolism important is that of your like gout. Important, very, very important. What is gout? What are the different risk factors of gout and how you will treat the gout? Okay. Next is that of important short note is salvage pathway, and important is short note is Lesch-Nyhan syndrome. So salvage pathway, gout, Lesch-Nyhan syndrome, and orotic aciduria. Okay. So these you must read in your metabolism of nucleotides. Now comes on the heme metabolism. Heme metabolism, jaundice, very, very important. What is jaundice? What are different types of jaundice? Okay, what are different types of acquired? You have to know each and everything about the jaundice. You know? All right, and what is jaundice? You should know the definition of jaundice. What is the congenital? And what is acquired jaundice? Okay, so congenital, you have to know basic idea about rotar and everything. No, Crigler Nazar and rotar, everything. So congenital jaundice also, as well as acquired jaundice. Acquired jaundice, the question can be asked how you will differentiate the prehepatic, hepatic, and post-hepatic jaundice clinically. Okay, so you should know it. Okay, in jaundice. And heme catabolism is very important. Okay, how heme is catabolized in the body. Now, how bilirubin synthesis is there, so how heme is catabolized in the body. Heme catabolization. Okay. Now, next in the second paper comes on the nutrition. So important topic in nutrition is that of short note. And question can be asked from nutrition as a short note. That is of calorific value. You must read, and BMR, basal metabolic rate, and next is that of SDA, that is specific dynamic action of food. Read and must read topics in nutrition. Another is that of glycemic index and glycemic load. Both have as a short note. Another important is that of biological value of proteins and nitrogen balance. Another is that of thermogenic effect of food. Okay, thermogenic effect of food, and balanced diet. What is balanced diet? Okay, and in some university exam, parenteral nutrition is also as a short note. So prepare parenteral nutrition also as a short note, and food toxins and additives. Okay, and what is PEM? Kwashiorkor and Marasmus. Okay, PEM, you know. Okay, PEM. Okay, now comes on vitamins and minerals. In vitamins, for LAQ purpose, you must know. Prepare as a vitamin A, vitamin D, vitamin C. A, C, D, you must prepare as a LAQ. And for short note, the vitamins, important vitamins is that of B3, your B6, B12 and vitamin K. So B3, B6, B12 and vitamin K important your short note. Although you should have a basic idea of each and every, because in exam it's not predictable which vitamin should ask, but at least these are, you have to must read, like A, C and D, prepare as a LAQ, and short note is that of B3, B6, B12 and vitamin K. Okay, in mineral metabolism, important is that of calcium and phosphorus mineral, and how the homeostasis of calcium and phosphorus is maintained in the body. Iron metabolism. Iron metabolism is must read topic of our MD. Okay, you cannot skip iron metabolism. Iron metabolism, each and everything is important. How iron is metabolized, what, and mucosal block theory individually asked as a short note. Okay, mucosal block theory individually asked as a short note. So you should read each and everything in iron metabolism. Mucosal block theory asked as a individually as a short note. Hemochromatosis asked as a short note in iron metabolism. And how iron is absorbed in the body asked separately as a short note. Otherwise, iron metabolism, each and everything you must know. And what is the iron deficiency anemia? Okay. And besides that, in mineral metabolism, the short note important is that of your Wilson disease. copper metabolism. So you know what is Wilson disease and what are the clinical feature and what is the treatment of Wilson disease and Menkes disease. Okay, Wilson and Menkes in copper metabolism. Another important is that of selenium metabolism. Only this, up to this you just read. And sodium, potassium. Besides that, sodium, potassium. So calcium, phosphorus, because calcium and phosphorus go side by side, right? Alright. Both homeostasis are regulated in same manner. So calcium, phosphorus, sodium, potassium. Okay. How sodium and potassium are regulated and what is the role of sodium and potassium in your body and what are the clinical features of your hyperkalemia, hypokalemia, and what are the ECG changes in hyperkalemia, hypokalemia. You must read. And besides that, iron metabolism must read. Each and everything in iron metabolism is important. Okay. And next is that of in copper metabolism, Wilson and Menkes disease. Okay. And selenium. Okay. Only that mineral is important. Okay. Nothing, you don't go prepare another minerals for your exam. Okay. Now comes on the detoxification. Xenobiotics. Whole xenobiotics is important. You must read what is xenobiotics. What are the phase 1 reactions of xenobiotics? What are the phase 2 or conjugation reaction? Xenobiotics asks as a LAQ, in which both you must write all both phase 1 and phase 2. Otherwise, short note asks individually on phase 1 or sometimes short note asks on phase 2. So phase 1, phase 2, conjugation reaction, xenobiotics, everything, whole chapter you must read of xenobiotics. Now comes on the free radical and antioxidant. This chapter is also each and everything is important. You should know the free radicals and what is the antioxidant defense mechanism in the body and what is the disorders which are or diseases which are associated with the free radicals. Okay, in some exam, if you have time, so you just prepare what is the oxidative stress marker in blood, urine and other biological fluid. Because in 1 or 2 university exam before, that question is asked as a short note. That is, what is the oxidative stress marker in blood, urine and other biological fluid, and oxygen toxicity also asked as a short note. Alright, so this is all about in your paper 2. So these are the must read topics in your paper 2. In next video, we will discuss paper 3. Okay, so that's all for today. Thank you.